So we're going to look at writing a referral letter today, which is going to be writing a referral letter to a specialist, a gastroenterologist, for further assessment and management. So this is how the case notes look like, where at the top of the case notes, the profession would be mentioned, and you have the timings mentioned here. It's very, very important that you are familiar with the layout of the case notes, so you know exactly where to look for the information. It's very important to be familiar with the layout of the case notes, and that is why I always prefer to make sure that all the case notes you are referring to have official layout, right? So this is exactly how the case notes in exam would also look like. Which section you should be reading the first is at the top, the notes. These notes are going to give you the background as to who you are and what is your relationship with the patient. Okay, is it a patient admitted in your ward? Is it a patient you operated upon? Or is it a patient who has been visiting you at your practice? So here you can say it says Mr. Patrick is a patient in your general practice. So you get to know that this is a patient visiting you at your clinic. After reading the notes, you go to the writing task, and the writing task gives you information about the target reader and the purpose of writing the letter. So here it says, write a letter of referral to gastroenterologist Dr. Thomas, and the writing task would also give you the purpose of writing. So what is the purpose here? Seeking his advice on diagnosis and assessment. And then you have the address of the target reader given. So if you develop the habit of reading it in a specific sequence, you can effectively utilize the 5 minutes reading time. Okay, you get 5 minutes of reading time to understand the case notes, to interpret them. After reading this, if you still do not have a clear purpose, for example, the writing task just tells you seeking his advice on diagnosis and assessment, but diagnosis and assessment of what? What disease condition he is suffering from, or what is the current issue? So in that case, without having to read the whole case notes, you should first read the plan. This plan would also give you a brief information about the purpose. So here it says advice on smoking cessation, counsel on IBD and likely investigations, and refer to gastroenterologist. Always remember, this is the plan that you have developed. Okay, and that is why I see refer to gastroenterologist is one of the plans that you have made. That means advice and counseling you are going to do, and you want the gastroenterologist to confirm the diagnosis, maybe conduct further tests and confirm the diagnosis. Right? So not everything that you have in the plan is always for the target reader. There will be specific things which are to be requested to the target reader. Now, once you have got these three answers, who am I, who is the target reader, and what is the purpose of writing, that's when you start reading the whole case notes to find out answers for two questions. What information is relevant for the target reader, and what information is not relevant for the target reader. Now what I'm going to do is, I'm going to allow both of you to read through this case notes once. I'm going to give you say 5 minutes time. I think that would be enough. Read through this case notes and make a mental note as to what information do you think will be required for the target reader, and what information can be eliminated, can be excluded, or can be generalized. How do you decide what information is relevant for the target reader and what is not? Is based on who the target reader is and what is the care that you are expecting from them. Okay? So here you are expecting them to conduct further assessment and to confirm the diagnosis. So the factors that you think could be helpful for them in making diagnosis or in confirming diagnosis are to be highlighted. And then there could be a few pieces of a few pieces of information which could be relevant data from their social or medical background. So in this entire case notes, you can see that you have just one visit. Here, the patient has visited you today itself, and you have the data from the patient's past medical history, social history, family history, medications. Then you have objective data from your assessment and some blood test results as well as the result of the fecal blood test or fecal test basically, where you could locate or you could find out occult blood. And finally, you have your provisional diagnosis. So your provisional diagnosis happens to be inflammatory bowel disease, which could be either because of Crohn's disease or it could be because of ulcerative colitis. So you have, in total, you have three differentials here. And the diagnosis is not yet confirmed. They are all provisional or probable diagnosis. So whenever you are writing a letter of referral where you want the reader to make diagnosis, what you try to do is you try to provide them details of the patient's symptoms, okay, as they have developed. Now that details would definitely include the timeline, the type of symptoms that they are having. For example, if it is a pain, it's very important to say what kind of pain is it, where exactly is it located, are there any associated symptoms, right? So that is definitely a very, very important piece of information. So I definitely have to add the timeline. I need to say what kind of diarrhea it is, what kind of pain it is, where exactly the pain is, what are the other associated symptoms. So these are all very, very important points for me to include. Now you would see that the case notes that you have would also have some information about the patient's social background. Right? You can see here it says it gives their age, profession, whether they are married or not, or what kind of family do they have. Now, depending on the target reader and the purpose, you would have to decide whether that information is relevant for the target reader or not. So here, probably their age, is a very important factor, but they being single or married has nothing to do with their present condition. So this is one point which you could exclude. Similarly, whether they live with parents or alone has no direct impact on their current condition. Accountant, I would say it is the category of information that would be useful, but not absolutely necessary. Right? So you always divide the information given in three categories: essential, useful, and irrelevant. So these information which we have ticked with green are all essential information. You can't skip that. Okay. Um, their marital status and the family situation is irrelevant for the target reader, so that must be excluded. And accountant, is useful, which means if you write, it would be great. But even if you don't write, it's not going to have a major impact on their condition, okay, or it's not going to have a major impact on how the gastroenterologist is going to make his assessment. Then, when you look at the family history or the social history, you would have some factors associated with their lifestyle. So you have a habit of smoking here, um, and you have a family history of Crohn's disease. Now, again here, habit of smoking probably is not directly relevant to their symptoms, but it is useful. Okay, and this is uncle has Crohn's disease. It's a very, very important history. So we need to include that. And then here it says they are a squash player, and then because of anxiety and the problems, they are not able to manage this. So in inflammatory bowel disease, the factors like anxiety or embarrassment could sometimes worsen the situation. So in that case also, this is going to be a useful information, but we are going to make sure that we are making a very brief note on this. This is useful, okay, not absolutely necessary. Dietary modification unsuccessful, very important, because if the gastroenterologist is planning to start the treatment, they should consider that the diet modification has already been tried. Then again, as I said, recently stopped attending Friday evening sessions. So these are all piece of information which you are going to generalize and may not be absolutely necessary points. And this is again very important, over the counter medication that they have taken, it hasn't been effective. Yeah. It says has attempted to self-manage illness by diet and OTC pain relief, but then the symptoms are still there, they constantly have the pain, so the medication has been taken. Now what do you think about the intermittent joint pain that they are having? Do you think it is important to include it?
Ma'am,
Do you
it's
think
not
it is
important.
not important, right? It has no connection with their present condition. So you straight away exclude that. There are no allergies. So again, you don't need to specify that. If there were allergies, you would have mentioned it. And all the data that you have from today's visit are important. The physical examination finding, the result of blood test, fecal occult blood test, and CRP. So these are all information that are going to be included in our letter. And the factors which are not quite relevant, for example, there are no abnormal findings there. So we are going to use this to suggest in a way that apart from the tenderness, there were no other abnormalities, right? So this is the physical examination finding also. I'm going to discuss with you how you can generalize this by just highlighting the main abnormal or remarkable finding that you have, and you can give the message to the target reader that apart from this tenderness, there wasn't any other issue that they were experiencing or you noticed that. Okay? So you can see that if you are able to select relevant information, a lot of points will be excluded from the task, and that would help you focus, or if it would help you to highlight the main points within the case. Right? So this activity which we did just now should not be taking more than 3 to 4 minutes for you when you are reading the case notes. It has to be a mental note, because for the initial 5 minutes you would not be allowed to have a pen or pencil in your hand. So you have to make a very quick mental notes of what you are going to include or exclude. Now after this stage comes the planning. How are you going to organize your information? So the case notes, will have information organized most of the time in chronological order, And you will always have the past medical history first and then the current issues. But you are supposed to decide which organization would work for your target leader. So you may not follow, or it would not be possible 99% of the time to follow the sequence of the case notes, right? So definitely when you're writing about today's symptoms, you can't in between go on to write about the family history or the smoking things. You first have to provide them details of the symptoms, physical examination finding, blood test results, and then maybe you can write a separate paragraph on what can be the contributing factors, right? So there are different ways of organizing your paragraph, and those ways can be mainly divided into three categories. You can either have writing in chronological order, or you can have main issue and associated problems, or you can go problem and solution type of paragraphing. But when it comes to medical referral letter, most of the time the chronological um, you know um, paragraphing works the best, because you are trying to explain how the symptoms have developed. Okay. And of course, when you write in chronological order, you again try to only focus on the main issue, even though you have a lot of other information in the same sequence or in the same dates, but you try to segregate that additional piece of information as contributing factors. You don't you make sure that those additional bits of information are not affecting the flow of your letter. So in this particular letter, if I was to organize my paragraphs, what I would be doing is I would be putting today's symptoms, okay, physical examination findings in one paragraph. And in one paragraph, I could probably elaborate on the blood test results and the fecal occult blood test that we have here. And then in the fourth paragraph, the which happens to be the second last paragraph, there I can request the gastroenterologist as to what I want them to do, and what I have done for the patient. So maybe smoking cessation is not directly relevant, so this is again optional. But I would have to tell them that I have explained the patient about probable diagnosis, or the patient is familiar with his current situation. That becomes a very important point, so that the gastroenterologist is aware, that the patient knows what is happening, or the patient is aware of what the situation could be. So I can put all these points in the fourth paragraph. Alternatively, what I can do is, in the fourth paragraph, I can summarize rest of the factors. For example, the family history and how this current condition is affecting his social life, and the medication that he has taken. And then in the fifth paragraph, I can make a final request. So that can be, two alternative approaches that you can take. But definitely the second paragraph, okay, which is the main and the first body paragraph that you have, should highlight the details of main issues. So let us make a plan, right? What I would be doing here is I would be highlighting certain portions of the case notes and marking it with a paragraph number. So the age of the patient, okay, and their name, we usually write in the reference line, the RE line. In the first introduction paragraph, we include the reason for writing. So reason for writing is here for further diagnosis and assessment. So that this is going to go in the first paragraph. So let me mark it with number 1. Then the probable diagnosis. This now definitely I can't add all three diagnoses in the introduction paragraph. So which one do you think which term would work as an umbrella term for the patient's condition? If you were to explain the symptoms that the patient is experiencing right now, what would be the term that you would pick up out of this three, which could clearly explain what problems is the patient experiencing? Because if you can, IBD, right? Because Crohn's disease and ulcerative colitis also are types of inflammatory bowel disease. So what we would do basically here is we would cover the inflammatory bowel disease in the introduction paragraph, and then the differentials that we may consider can be written in the last paragraph where you're trying to make a request. Okay, because as a GP you are writing to a specialist. So obviously when you are writing to someone who is superior to you, or at least someone who has a specialist knowledge, or you wouldn't kind of write sentences which would look like an advice, but you would rather write sentences which would look like a suggestion or a polite way of conveying what is your point of view over here. So you will be writing a sentence which would probably you would say the possible differentials may include this, or I believe this could be related to this. So but if you say I believe this could be related to this, it is sounding less polite. Okay, because you are trying to emphasize your belief on the specialist. So that is these are the sentences which can affect your score in genre and style, because genre and style is looking at your ability to realize, or the audience awareness. Depending on the audience, you should be able to modify your phrases and sentences in a way that they sound polite. Okay, so maybe if you were writing to a junior doctor, you could have written I believe, but when you're writing to a specialist, rather than saying I believe this could be ulcerative colitis, you would say the possible differentials may include. Okay, so that's your view of looking at it, maybe, and then they are the specialists to think whether it is actually related to Crohn's disease or ulcerative colitis, or it could be something else. So we would be in the introduction paragraph, we will be just writing an umbrella term, that is IBD, and then we'll write possible differentials in last paragraph, because we always write the purpose of writing twice. We write it once in the introduction paragraph, and then we expand it in our letter mainly towards the last paragraph. So when you are writing it in the last paragraph, you will have to make sure that you are expanding on the purpose rather than just writing the same way as you have written in the introduction paragraph. So both those sentences should look very different from each other. Okay. Then, as we discussed, the second paragraph is going to be mainly the description of the patient's current symptoms. Okay, and here you have to be very, very careful about the tenses that you use, because it says 4-month history of chronic mild diarrhea. So all these symptoms that patient is having are there for 4 months. So if you would just say on 21st Feb, he presented with these complaints, you are not giving them the correct timeline of how the symptoms have developed. So it's very important to mention that these symptoms are going on for 4 months. Okay, and after that, once you have mentioned those things in the paragraph, here, this was our second paragraph. And then what all things have they tried? So the diet modification, again in the second paragraph, and this, as we had discussed earlier, will be your first paragraph. And because we are writing about the diet modification in the second paragraph, the medication that they have tried. Maybe you don't need to write the exact dose that they have been taking, but you can just mention it as over-the-counter medication that the patient has taken, right? Then the third paragraph would be entirely on the evidence that you have from your physical examination and from the blood test. Fourth paragraph, as I said, there can be two approaches. One way is that you can add the purpose in fourth paragraph, or you can expand the purpose in the fourth paragraph. There is one way of writing. Alternatively, you can write all the relevant factors in the fourth paragraph. Okay? So here, because I'm writing purpose in the fourth paragraph, the relevant issues or other associated problems can go in the fifth paragraph. Okay. Now, how do I decide my paragraphing? What are the points that I have to keep in mind while I'm planning the paragraphing is, see, it may not be possible for me to ensure every time that each of my paragraph has the same size. It's not practically possible, right? Sometimes one paragraph can be lengthier than the other, and that's absolutely natural. Even if you read any of the news article, or if you read any article from a medical journal, it may not possibly have all the paragraphs of the same size. So when you are considering paragraphing, don't think that if I put this information in this paragraph, then it will be too small, so let me add one more piece of information. Don't do that. You may not have all the paragraphs of the same size, and it is not necessary. What is important is each paragraph should have a separate theme, which means in that particular paragraph you should only write issues related to that particular concern, right? So those are the two things you need to consider when you're deciding your paragraphing. One is that in one single paragraph, all the ideas that you have included should be related to the same theme. For example, here you can see in the second paragraph, it is all about how the symptoms have developed, and how the treatments that patient has tried have not been effective. And in third paragraph, it is all about the physical examination finding and the test results. Fourth paragraph is just a purpose, expansion of the purpose. And fifth paragraph is the relevant social or medical history. And this differentials will go in fourth paragraph, since I'm expanding my purpose in fourth. If I was expanding my purpose in fifth, they would go in the fifth paragraph. Right? Are we all now clear on this? The paragraphing. So what are we going to do next is, I'm going to ask each one of you to write a specific paragraph. Okay, this time we are going to do it slightly different. Each one of you would be writing a different paragraph. So the task that I'm sharing right now is for the medicine students. So what I would be doing basically here is, I would be asking so ideally now what you should do is, once we have discussed the whole pattern of the letter, you should write the letter on your own, and then go ahead and compare with the model answer, okay, and see how the sentences that you have written are different from the model answer. Is the tenses used the same or not? So that could be very, very useful activity for you to learn how to write a good summary in the writing task.